Salam and Hello, I'm Khadija and welcome to The Balanced Deen. Every year, roughly 12% of Muslims fasting during the month of Ramadan will experience one or more migraines. Migraines are a common chronic neurological disease characterized by episodic attacks with headache and related symptoms. Migraines can be triggered by a host of factors, and in today's video, I want to discuss the most common triggers experienced during the month of Ramadan and ways to help prevent a migraine attack from occurring. Number 1, caffeine intake or withdrawal. In general, caffeine intake and consumption has its pros and cons. For habitual coffee drinkers, they may feel dependent on coffee in order to stay awake and feel energized to move through the day. A sudden withdrawal of caffeine may bring on migraines, tiredness, and irritability. For others, drinking coffee or other beverages with caffeine can actually start a migraine episode. How, you may ask? Well, research shows that an increase in coffee can cause a loss of magnesium through the urine. And magnesium is a chemical element that plays a role in various physiological functions, including neuromuscular and nerve transmissions of chronic pain, such as headaches and migraines. Without getting too bogged down in the research, here's what you should do if you drink caffeinated coffee, tea, or others. Steadily withdraw the consumption several weeks before the beginning of Ramadan. So for example, if you drink a cup of coffee every day for the week, then you would want to drop back 1 to 2 cups of coffee per week, eventually eliminating your need for coffee. Some of you will be able to tolerate this sudden withdrawal of caffeine. Some of you won't. It all depends on how your body responds. The idea behind eliminating coffee is that you are no longer dependent on the stimulant effects that caffeine has on the nervous system. In the same scope, by the end of the day or around iftar time, some of you would like to drink coffee or tea. Yet keep in mind that it is advisable to avoid caffeine for up to 6 hours before bedtime. Some of us are already on shortened sleep due to waking up, for example, for tahajjud or spending time with family and friends after Taraweeh prayer. So we don't want to risk losing the little sleep we get by drinking more coffee. And that brings us to the second trigger we should talk about: a poor or irregular sleep schedule. This is a difficult one, as I previously mentioned, because we are up early for suhoor and or tahajjud and likely up later than most days after Isha prayer. This makes it challenging for us to not only fall asleep, but to also remain in a deep sleep, also known as the non-rapid eye movement sleep. As a result, we are not well rested, and in turn we are more fatigued, irritable, have a lack of concentration, and this can all trigger a migraine. We can't grab a pick-me-up, such as coffee, fruit, or even candy during the day, so planning to get quality sleep is very important and can help prevent migraines. It is also advisable to limit and reduce the time you spend on your phone and watching TV. Number 3, dehydration. We are more likely to be dehydrated during the month of Ramadan because we are not taking in water or food during the day. And we are also not replenishing enough with water in the evening during iftar, nor in the morning at suhoor time. When we break our fast, we may tend to sip water, eat one date, eat a few pieces of fruit, and then feast on a big meal. Now, there is some controversy around how much water one needs during the day. Is it 1 liter? Is it 2 liter? Is it 3 liter? In this case, we should actually lean towards the latter, or more water, in order to remain healthy and limit the possibility of experiencing migraines. So let's say 2 to 3 liters if you can. And number 4 on the list, having a drastic change in diet. During Ramadan, we are more likely to eat meals that have a high sugar content and that are high in fat. While it is important for you to enjoy your iftar meal that might include a cheat meal or dessert every now and then, it is also important to understand that sudden changes in your diet may bring about migraines. Research shows that low glycemic diets that are high in protein are useful in preventing migraines. They are also beneficial in managing oxidative stress, inflammation, and gut function. And to cap our list at number 5 is therapeutic prophylaxis. Now, I debated on whether or not to list this as one of the ways to prevent migraines because although there is approved medication available, it is often recommended to people whom experience frequently occurring migraine headaches that are not necessarily associated with fasting during the month of Ramadan. Therapeutic options include over-the-counter agents. Consuming any of these therapies should not be taken lightly, And if you think your migraines are truly not triggered by fasting during the month of Ramadan, or by any of the triggers I mentioned today, I encourage you to talk to your physician or nurse practitioner to discuss further. Please be sure to leave a comment below if there are other methods that you use to prevent a migraine from occurring. If you experience a migraine or any other medical condition, I praise Allah subhanahu wa ta'ala, give you shifa, and make your fasting easy for you and for all Muslims during the blessed month of Ramadan. Thank you for watching.